Hi, welcome to Healing Tunes. Please watch the video. Epigastric pain is a name for pain or discomfort right below your ribs in the area of your upper abdomen. It often happens alongside other common symptoms of your digestive system. These symptoms can include heartburn, bloating, and gas. Sometimes thoracic and abdominal muscle trigger points refer pain mimic the epigastric pain. Today we are discussing the abdominal muscle trigger points and its referred pain. First we are discussing the rectus abdominis. Upper trigger points refer to the mid back, lower points to the lower back. The fact that this muscle refer pain to the back means that if you work on the back erector group is not providing relief, look to these muscles. Rectus abdominis also will be taut, tight in clients who slot a have a posteriorly rotated pelvis. If a client has an anteriorly rotated pelvis, strengthening this muscle can help the hip to come back into the alignment. It is not true, however, that the strengthening the rectus abdominis will automatically help the lower back. Next is the external obliques. Multiple referral patterns that run along the abdomen. Upper trigger points can mimic heartburn. Lower trigger points can refer into the inguinal ligament and genitals. It mimic heartburn and epigastric pain. Next is the iliocostalis. Trigger points around T6 refer into the inferior portion of the scapula and also into the chest area, which can mimic angina. Trigger points around T11 refer into the mid back with spill over upwards into the scapula and down into the ilium. These points can also refer into the abdominal region, mimicking visceral pain. The trigger point around L1 refer deep into the mid buttock. These muscle trigger points are along with longissimus and multifidus are often a major factor in back pain. Next muscle is the multifidi. Trigger point in the thoracic and lumbar section refer around themselves. Trigger points at L2 and S1 also refer into the abdomen. Trigger points in the cervical region refer down into the scapula and posterior neck. Trigger points in the lumbar section of this muscle are very common cause of lower back pain. Next muscle is the quadratus lumborum. This muscle trigger point, the uppermost trigger points refer pain to the SI joint and the lateral hip. The most inferior point refer into buttock. The middle trigger point refer over the SI joint. Some people report to jolting pain into the anterior thigh from deep quadratus lumborum trigger point. The points that refer over the sacrum and cause sacral tenderness can cause a mid-diagnosis of SI joint dysfunction. Next is the pyramidalis. This muscle trigger point refer pain near the midline between the pubic bone belly button. But this muscle is absent in 20% of people. Please subscribe the channel, like the video and share it. Thank you for watching our channel.